Good day, everyone. My name is Nancy, and I am inviting everybody to join me as I perform a physical assessment on Tina Jones. Tina Jones is a 20-year-old female who presented to the clinic for a job-required physical exam. My customary practice is to greet my patient, hi, hello, good morning, and also to verify his or her name and date of birth, and this practice helps me to assess the patient's orientation as well. And at this point, I am going to assess or to ask Tina about her name and date of birth, as well as the place that she is in right now and the date today. I will start my head-to-toe assessment with obtaining Tina Jones' vital signs to determine how is she doing today. Her blood pressure at the moment is 128/82, heart rate of 78, respiratory rate of 15, temperature of 37.2 degrees Celsius, and her oxygen saturation at 99% on room air. Okay, at this time, I am going to inspect and palpate the scalp, and at the same time, this gives me opportunity to also inspect the whole face. And I am going to start in palpating the head, and this is to look for any abnormalities such as masses or lumps or any contusions or abrasions, any tenderness, any balding or thinning of the hair areas. Okay, and now I am going to inspect the eyes, and I have this opportunity also to inspect the face. And I can see pustules on the left and the right cheek. Okay, I am going to inspect the lower eyelids, check the conjunctiva, I'm going to check the sclera, and also the upper eyelid as well. Okay, by using a pen light, I can determine if the pupils are reactive to light and accommodation. And I'm going to start on the right eye. Turning on and turning off the pen light will give me an idea if the pupil is reactive to light and accommodation. Okay, there you go. Very good. Checking the left eye. I am turning on and turning off the pen light, and I can see the increased and the reduction of pupil size upon turning off the pen light. Okay, using the ophthalmoscope, now I can see the inner aspect of the eye. There you go, pupil is reactive and going deeper to the retina. And this time, I am assessing for any abnormalities, for any hemorrhages, for any cotton wool bodies, and also the disc shape. Okay, moving to the left eye. There you go. Pupil is really good and getting into the deep area of the eye. So same thing, I am looking for any abnormalities, for any hemorrhages or any cotton wool bodies, and I also wanted to assess the disc shape. Okay, now assessing my patient's visual acuity, and I want to perform this with the patient's participation. I will ask Tina to read a line, and I needed to cover the right or the left eye to assess this part. Okay, so covering the right eye, now Tina has to read the line. Okay, very good, Tina. And now I'm going to uncover the right eye and move to the left eye, and I will ask her to read the line as well. Okay, thank you, Tina. Okay, so going to the ears, I am going to inspect the right ear. I don't see any drainage. The color is pink. There's no paleness. And same thing on the other side. On the left ear, I don't see any drainage. Okay, using the otoscope, now I can see the inner aspect of the ears. So right now I am inspecting the right ear, and I can see the tympanic membrane is pearly gray. There's no drainage, there's no erythema, and the cone of light is at the 5 o'clock position. It's not distorted. Going to the left ear, I can see the tympanic membrane is intact. It's pearly gray. There's no drainage. There's no erythema. And the cone of light is at the 7 o'clock position, not distorted. Okay, going down to the nasal mucosa, I am inspecting the right nostril. Okay, it's moist and pink, patent turbinate. There's no drainage noted. The left nostril, it's patent turbinate, moist and pink, and there's no drainage noted as well. Okay, and now I am inspecting the oral mucosa, and what I wanted to look, or I wanted to assess, is the tonsils, if there's cobblestoning, if there's postnasal drips, and also the dentitions and the tongue as well. I want to test also the gag reflex. Okay, now for the jaw, I wanted to check if there's clicking and tapping sounds, and also I want to check the range of motion. So the sinuses, I want to see if there's tenderness or any signs of infection, if there's pain. And as of this moment, the patient did not report any pain, and there's no signs of existing sinus infection. Okay, palpating the cervical lymph nodes, and this is to check for any abnormalities if there's lymphadenopathy. There you go. Thank you, Tina. Okay, and then I'm going to palpate the supraclavicular nodes to check for any lymphadenopathy as well. Okay, now I am going to check the thyroid if there's any enlargement. There you go. And again, I'm going to auscultate the carotids for any abnormalities if I hear any bruits, and that's a sign of a cardiovascular disorder as well. So I'm going to auscultate the right carotid and the left carotid as well. Okay, so my assessment on the head part. Head is normocephalic and traumatic. Bilateral eyes with equal hair distribution on lashes and eyebrows. Lids without lesion. No ptosis or edema noted. Bilateral conjunctiva are pink. No lesion with white sclera. Pupils are equal and round, reactive to light and accommodation bilaterally. Mild retinopathy on the right eye. Left fundus with sharp disc margins. No hemorrhages. Snellen 20/20 on the right eye. 20/20 on the left eye with corrective lenses. Frontal and maxillary sinuses are non-tender to palpation. Nasal mucosa are moist and pink. Septum at the midline. Oral mucosa is moist without ulceration. Gag reflex is intact. Dentitions are good. No evidence of caries or infection. Tonsils +2 bilaterally. Thyroid is smooth without nodules. No goiter. No lymphadenopathy. Okay, now I am going to assess the respiratory and the cardiovascular system spontaneously. And I'm going to start at the anterior chest. And I am going to perform an auscultation of the chest to check for any adventitious sounds, for any wheezing, for any stridor, or any crackles or rouse. I'm going to start on the right upper chest, going to the left upper chest, to the mid-level chest, as well as the lower chest. There you go. Okay, and as of this moment, I don't hear any adventitious sounds. And at this point, I am going to auscultate the cardiac points, starting at the right second intercostal space, which is the aortic area, and moving to the left second intercostal space, which is the pulmonic area, the Erb's point, the tricuspid area, as well as the mitral area. What I am trying to assess in here is the sounds of S1 and S2, and if there's any rubs, murmurs, gallops, or any abnormal heart sounds. Okay. This time I am going to do palpation, and I am going to check for fremitus. Okay, I'm going to start on the upper chest. So I am palpating, and I'm asking the patient to say the word 99. Okay, and going down to the lower chest. Okay, moving to the posterior chest, I am going to auscultate the lungs, starting at the left upper quadrant. Okay, and the right upper quadrant, I'm going to the mid-level and to the base of the lungs, which is the lower lobe. There you go. And also I'm going to palpate for any tactile fremitus, starting on the upper back. I'm going to ask the patient to say 99 as well, to the middle, and to the lower back. Okay, to finish with the respiratory system, I am going to check the patient's spirometer level, and by using the spirometer, I am going to instruct her to blow into the spirometer. Okay, and this time I am checking the forced expiration against the forced vital capacity, and the normal value is usually approximately at 75%. And based on this ratio, Tina Jones got a score of 80.5%. Okay, my synopsis for the respiratory and cardiovascular system. Chest is symmetrical with respiration, clear to auscultation bilaterally without cough or wheezing. Spirometry, forced expiratory volume 1 against forced vital capacity ratio of 80.56, which is considered normal. And now going down to the cardiovascular system, heart rate is regular, S1 and S2 are audible without murmurs, gallops or rubs. Bilateral carotids are equal bilaterally without bruit. BMI at the mid-clavicular line, fifth intercostal space, no hives, lifts, or thrills. Checking the abdomen, I am going to start by inspection. I am going to inspect the abdomen, the front, and I can see it's protuberant, and also I can see the discoloration at the navel area, as well as the coarse hair and between the umbilicus and the symphysis pubis. And now I am going to do auscultation, which on this one, I am going to check for the vowel sounds. I'm going to start in a clockwise motion, starting at the right lower quadrant, going up to the right upper quadrant. There you go, very good. To the left upper quadrant, and then now to the left lower quadrant. And I can hear a normal active vowel sounds. Okay, now I'm going to palpate the organs. I am also going to do a dip palpation. So starting with a clockwise motion as well, I'll start on the right kidney. There you go, very good. Going up to the liver. So it is palpable 1 centimeters below right costal margin. Now going to the left upper quadrant, which is the spleen. And down to the left lower quadrant, which is the kidney. Okay, this time I am going to do a deep abdominal palpation. This is to check for any organomegaly as well as masses or lumps. Again, I'm going to start in a clockwise motion, starting at the right lower quadrant, going to the right upper quadrant. See, as of this moment, no masses are palpable. And now to the left lower quadrant. Very good. And also, I am going to assess the costo-vertebral angle. I am going to percast the left kidney. There is no pain reported by the patient. Going to the right kidney. And again, no pain reported. Okay, my summary for the abdominal. Abdomen is protuberant, symmetric, no visible masses, scars or lesions, coarse hair from pubis to umbilicus. Bowel sounds are normal active in all 4 quadrants. No tenderness or guarding to palpation. No organomegaly, no CVA tenderness. Okay. So, now going to the musculoskeletal system, and also I will assess the cardiovascular system with the pulses, checking of the pulses, starting with the upper extremities. I am going to palpate peripheral pulses, and I am going to see if there's adequate. I'm going to start on the right brachial pulse. Okay, there you go. It is strong. Going down to the radial pulse on the right side. Okay, moving to the left side. I am going to check for the brachial pulse, and it's +2, and going down to the radial pulse. Okay, the patient has adequate pulses. I'm going to check the tendon reflex, starting at the tricep. There you go. Very good. I can see it. Now going down to the bicep. Okay, patient is reactive, normal. Going down to brachioradial reflex. Very good. Good job, Tina. And now, going to the left side. Again, I'm going to test the tricep reflex. Very good. Going down to the bicep. And then to the brachioradial reflex on the left side, the left upper extremity. Okay, and they're all class 2 and they're normal. Okay, now I am going to assess see the hand movements, and I will ask Tina to place her hands on the knees and turn them over so that I can check the speed, the rhythm, and the smoothness of her movements. Okay, going down, I'm going to inspect the fingernails. I am going to assess for any clubbings, for any ridges or any abnormalities. And right now I don't see any abnormalities, and also I'm going to assess the capillary refill, which is also a sign of adequate blood supply to the fingers or to the lower, to the upper extremity. Okay, testing the right index finger. Okay, very good. And it went back to its normal color. Move into the left index finger. Same thing, it went to its normal color. And capillary refill of less than 3 seconds. Okay, now I'm going to check the hand strength. I am going to ask the patient to grasp my fingers. There you go. And I am going to ask her to tilt the wrist down. Very good. Good job, Tina. And this time, I'm going to ask her to tilt the wrist up. This is also to check the range of motion. Okay, now I am going down to the lower extremities. And at the same time, I am going to inspect also for the pulses as well as the strength. And also I'm going to look for any signs of edema, and that is a sign of poor circulation if the lower extremities are edematous. And now I am going to palpate for the pulses, starting at the right femoral artery. Okay, going to the left femoral artery. Okay, so far we're doing good. It's +2. I am going down to the popliteal pulse. Okay, there you go. And going downwards to the posterior tibial area. Very good, and we're doing good. It's +2 on the left side as well. And now the dorsalis pedis pulse. Okay, very good. All right. Okay, now I'm going to check the tendon reflex on the lower extremities. I'm going to start with the patellar reflex on the right side. I'm going to check the left side as well. There you go, it's reactive. Okay, going down to Achilles reflex, checking the Achilles reflex. Very good. All right. Okay, this time I'm going to assess the hip strength. I will ask Tina Jones to push her knees up towards the ceiling, and what I'm going to do is to resist the movement to see the strength. Okay. And now I am going to assess the knee strength as well. And I will ask Tina to straighten her legs out all the way, and while I push lightly on the shins. All right. Okay, now checking the ankle strength. There you go. I am going to ask Tina to push, like pushing a gas pedal. Then I will push back, and I want her to keep her toes pointed upward. There you go. Okay, I am going to inspect the toenails. Okay, I am looking for any clubbing, for any ridges or any abnormalities. And right now, I don't see any abnormalities. Okay, I'm going to assess the cup refill. I want to see it like below 3 seconds. Touching or testing the right big toe. Okay, there you go. Very good. It went back to its original color at less than 3 seconds. Okay, going to the other side on the left big toe. There you go. Thank you, Tina, for your cooperation. And now I am going to test for any peripheral neuropathy, and I am going to use a 10-gram monofilament to touch Tina's feet. To start with, I am going to ask Tina to close her eyes and tell me when she feels the touch. Okay, I am going to touch the right great toe. Moving down to the forefoot under the great toe. To the right forefoot. And to the bottom right foot. And now, moving to the left side, I am going to touch the left great toe. Down to the forefoot, under the great toe. Okay, under the small toe. And the bottom left foot. Okay, very good. Thank you, Tina. Okay. I am going to give you the synopsis of the musculoskeletal as well as neurological because I did this assessment spontaneously. So for the musculoskeletal, Tina Jones has adequate peripheral pulses, strength 5/5 on bilateral upper and lower extremities, without swelling, masses, or deformity, and with full range of motion. No pain with movement, normal DTR on the upper and the lower extremities. Moving to neurological, test of cerebellar function is normal, DTR2+ and equal bilaterally in upper and lower extremities. decreased sensation to monofilament in bilateral plantar surfaces. Okay, and now the last one, I am going to assess the skin and nails. It's like a full body inspection, and I'm going to start on the upper extremity, specifically the neck area. And right now I can see it's like Acanthosis nigricans on the neck front. So inspecting the skin in the abdomen, there is like discoloration in the navel area. There is coarse hair present between the navel and the symphysis pubis. There is stretch marks like in front of the abdomen. Okay, and now check in the knees. Okay, the right knee and the left knee, as well as the ankle. And this one also gives me an opportunity to check for any edema or any bruises, contusions, or abrasions in the lower extremities. Okay, so my assessment on the skin and nails: the scattered pustules on the face and facial hair on the upper lip, Acanthosis nigricans on the posterior neck. Nails are free of ridges or abnormalities. No clubbing noted. Thank you so much for joining me in performing my physical assessment on Tina Jones. And again, thank you so much. Bye.